Welcome to the JBI podcast. I am Deepali Addagarla, a quality nurse consultant at Kaiser Permanente, Northern California. I am a master's prepared nurse with over 20 years of experience in adult critical care. I appreciate the opportunity given to me by JBI and my mentor, Dr. Vanessa Martinez, to review and share my thoughts on the manuscript by Owen Howlett and colleagues, The Use of Mentoring for Knowledge Translation by Allied Health, a scoping review. Knowledge translation is using research evidence to make informed decisions by healthcare professionals to improve patients' outcomes. Identification and translation of research evidence into practice is challenging in healthcare. Mentoring is one strategy that can support the translation of research into practice and is used to support an individual with identified learning needs. Mentoring differs from other professional supports such as coaching and clinical supervision in strategy, scope, and duration. In addition to individual education and skills training, mentoring is seen to be used by nursing and medicine as a knowledge translation strategy. Still, it is unknown if allied health professionals such as occupational therapists, physiotherapists, speech therapists, psychologists, and social workers have also used it in their practice. The manuscript's main objective was to describe how allied health professionals have used mentoring as a knowledge translation strategy to inform practice. The authors conducted their review using the JBI methodology for scoping reviews and used the framework developed by Karcher et al. To identify the mentoring characteristics section of the tool. The study trials included in the manuscript indicated that mentoring characteristics such as structure, goal, content, dosage, and resources varied based on the context of translation. The impact of mentoring was measured using professional evaluation and reflection on change tool, self-rating questionnaires inquiring usefulness of mentoring, and analysis of interviews. Mentoring promotes the use of evidence-based practices to make informed decisions, improve communication, build relationships, and promote positive clinical outcomes for patients. I have been both a mentee and a mentor in my nursing career. Mentoring has a great scope to improve clinical practice. It not only helps the mentee to get the necessary guidance and support to adjust to the new work environment, but also helps them learn from the mentor's knowledge, skills, experiences, best practices, specific protocols, and policies established at the organization. Both mentor and mentee are equally benefited in this mentoring process, as knowledge shared is knowledge gained. Utilizing mentoring as a means of knowledge translation by allied health professionals influences the mentee's capability, confidence, and competence to translate research into their practice. The ongoing support would guide the mentee and assist with their decision-making skills by utilizing evidence-based practices and promoting better care for our patients. Fostering mentoring to share knowledge among allied health professionals would be of great value and can easily be adapted across facilities and organizations. Performing a follow-up for feedback to identify the barriers is vital to develop a better mentoring strategy. Staff turnover, patients declining in activities beneficial for mentoring sessions, lack of technology, and scheduling conflicts were some barriers identified to mentoring. Some facilitators included the mentor acknowledging the mentee's value, level of knowledge, and the mentor's awareness of research to support the interventional technique. Being a mentor, I have experienced some barriers in communication, misperception, personality differences, professional experiences, clinical practices and protocols utilized, challenges in adopting new and different technology, and uncertainty if the mentee's expectations were met. Knowledge translation also depends on the mentor's willingness to teach and the mentees to learn. The authors identified some limitations with their review and a need for more consistency in how mentoring was delivered and measured. Future research is recommended to evaluate the impact of mentoring in allied health professionals and its effectiveness in translating evidence-based research into practice, as this knowledge transfer method can affect patients' quality of care and outcomes on a large scale. In closing, I want to thank JBI and the manuscript's authors for allowing me to share my thoughts and commentary. Thank you for listening.